Welcome back, everyone, to Let's Talk About Sleep, where we talk about sleep. You see over my shoulder there, that's the book, Let's Talk About Sleep. The link to that is in the description box down below. As I always say, these videos are for educational purposes only. With that being said, let's get into today's topic. So, during my question and answer video last month, somebody had asked a comment about me maybe talking about upper airway resistance syndrome, and I said I would do a video on that. So that's what today is. What is UARS? So when we talk about breathing during sleep, I've said this a million times, we're looking at the airway back here, okay, where the tongue sits, all right? So when we're awake and talking, our airway is wide open. Our tongue, our soft tissue, it's where it's supposed to be, and the airway is wide open. When we fall asleep, the muscles in our body relax head to toe. So these muscles here, the tongue, the soft tissue, it's going to kind of fall together. Okay, so everybody's airway, when we fall asleep, gets smaller. Now, so from here to here is normal. When it goes to here, when the airspace goes to here, the air is still able to come in and out, but it causes the tissues to vibrate. And that vibration is what snoring is. Okay? Then when it goes to this, that's what sleep apnea is. Okay, so awake, asleep, snoring, sleep apnea. But in between snoring and sleep apnea, okay, there is a tightening of the airway, okay, if we're looking at it as a spectrum. And when we do an overnight sleep test, whether it be a home test or an in-lab test, there are people who, if they have sleep apnea, it's going to show. The airway is going to collapse. We're going to see it in various ways, and we make that diagnosis, okay? On the other spectrum, we'll do our test and we'll find nothing, okay? We'll just have snoring, all right? But again, there is this kind of middle ground where it doesn't necessarily show up as a true stoppage of breathing, but the person is having tightening of the airway and it's triggering them to wake up. We call those respiratory event related arousals, RERA, or RERAs for short, okay? So what you find is when somebody's having a lot of RERAs, okay, they may or may not have the diagnosis of sleep apnea, but they may have this other thing called upper airway resistance syndrome. And all that means is basically the airway is tight, but not tight enough where actually they're having true stoppages of breathing. Okay? So that's what the condition is. Now, why is that important? Because you'd think, all right, well, it's the same thing as sleep apnea. Who cares, right? The difference, though, is that these patients have a much different presentation than those with sleep apnea do. These patients can have insomnia. They can have fatigue, not necessarily sleepiness, right? And I made several videos on the difference between those. They may be anxious. They may actually have hypotension as opposed to hypertension. So their blood pressure may actually be lower as opposed to somebody who has sleep apnea, obstructive sleep apnea, blood pressure may go higher, okay? And because this is not as well known of a condition, a lot of times it gets either swept under the rug or not diagnosed, and these patients can suffer, all right? Now, while it's very different than sleep apnea in terms of how it presents itself, the treatment is very similar, right? Which is CPAP, right? Keeping the airway open, right? So you force the airway open, it's not gonna, this condition, whether it be this or this, it's not gonna be able to happen, right? So that's one. So CPAP, right? Continuous positive airway pressure, or an auto-adjusting machine, APAP, can be helpful to do that, okay? But the problem with UARS patients that I have found is that they don't necessarily take the CPAP right away, whereas a sleep apnea patient, they're so tired, they don't feel good, their health is being affected. They put the CPAP on. I'm talking about a significant, severe case. They all of a sudden say, "Wow, I feel so much better. I feel great." UARS patients and milder cases of sleep apnea, it may take weeks, even months, before the body kind of realigns itself, let's say, to something called the HPA axis, hypothalamic pituitary adrenal axis. It's basically our kind of fight or flight system. That takes weeks for that to kind of really normalize itself when somebody has, especially UARS. Okay, so that's one. Option two is a dental device, right? We've gone over that. Pulls the lower jaw forward as kind of a mouth guard at nighttime. Okay, that also works for UARS patients. Making sure they sleep on their side, right, as opposed to the back. On the back, gravity is pulling everything down towards the back of the throat. Sometimes nasal steroids may help to kind of increase the airflow coming through. Sometimes what they'll do, ear, nose, and throat surgeons will do is called, or orthodontists, or people who do dental surgery, what they'll do is maxillary expansion. So the maxillary bones are here. They actually, especially in children, they can actually do procedures where they actually expand the maxilla. Okay, and it actually increases the volume in the oral pharynx, okay, or the oral area. Okay, so in children that's done, although actually they do have a procedure to do it in adults as well. Okay, so those are kind of the differences between UARS and sleep apnea. It's an interesting condition because you think it would be like kind of just a milder form of sleep apnea, but it's not. These patients present in different ways. Okay, but fortunately though, the treatment is very similar. The problem, though, that I have found is that insurance companies don't necessarily recognize this diagnosis, so they may deny the patient treatment. Okay, I've seen that before. And the bigger problem is that people don't even know that this exists. Okay, so it's not as prevalent, it's not as common as sleep apnea, but the consequences can be very, very very unpleasant for patients. It's not as dangerous as sleep apnea. These people are not necessarily going to have heart attacks and strokes the way a true sleep apnea patient will, but their quality of life can be very, very affected. So if somebody has UARS out there, they'll be able to tell you this is the case. So that's the video for today. Thank you for the person who recommended this. If you want me to go deeper, I will, but this is kind of a good overview of what UARS is and how we take care of it. Okay, so please share this video, especially with somebody who may have UARS, or somebody who snores, or somebody who may have sleep apnea. Share this with your friends and family. Please click like. Please subscribe to the channel. We're trying to inch towards 1,000 subscribers. And if you have any questions or comments, please leave them in the comment section. I read all of them. Okay, and then once a month I will do a kind of question and answer video. Okay, until next time, sleep well.